Howdy. Welcome to another one of my injury presentations. My name is Aaron Lang, and what you might hear in the background is the Texas Chainsaw Massacre being committed by my brother. I wish I was able to join him right now, but I'm not. So anyway, my name is Aaron Lang. I'm an undergraduate student at Berea College, making this presentation for Dr. Michelle Thornton Adler. The topic of this presentation is DeQuervain's syndrome, I think I said that right, which is a wrist tenosynovitis, but I'll get into that later. So how exactly is this video going to go? First, I'll provide some background about the patient, and then talk about the anatomy of the injury and how it occurs. Then I'll get into a SOAP note, with SOAP being an acronym standing for Subjective, Objective, Assessment, and Plan. The subjective portion of the note is where the patient tells me what they are feeling or how they are feeling. And it's not often perfectly reliable because differing patients have differing pain tolerances, but it is really important because the patient oftentimes knows their own body better than the clinician will, of course. The objective portion of the note is where I will record and observe different values such as range of motion or swelling. In the assessment or diagnosis, I'll put together the subjective and the objective portions of the note and determine what the injury is and what the state of the injury is. Finally, I'll come up with a plan, which is what will be done to recover or continue recovering this injured person. So our patient today is a Mr. Johnson, who is a 65-year-old male who is a competitive horseshoe pitcher and is experiencing pain in his dominant side wrist, especially around the thumb. So we'll cut to the quick and talk about why the pain is around the thumb. Well, the pain is because of DeQuervain's syndrome, which is characterized by tenosynovitis, which is an inflammation of the tendon sheath of the abductor pollicis longus tendon here and the extensor pollicis brevis tendon here. Both of these tendons attach muscles of the forearm to the thumb and move the thumb primarily back into extension or away from the midline of the body. So as I've already said, this injury is characterized by inflammation in the tendon sheath as opposed to the tendon itself of the extensor pollicis brevis and adductor pollicis longus muscles due to repetitive radial deviation. So if you were to imagine holding both palms out and then taking the thumbs away from the midline of the body, that is radial deviation if you move the whole wrist. This excessive radial deviation can be caused by activities such as hammering and pitching horseshoes. Pain is commonly found on the radial aspect, thumb side, of the wrist, especially along the dorsolateral aspect of the wrist. Dorsolateral is a really fancy word for saying the back and the outside of the wrist, along the thumb. Swelling and redness are common with this injury. Now let's do the eval. This is some of the history portion. The patient is a 65-year-old male with burning pain along the radial side of his right wrist. We already knew that. The patient reports no specific moments of increased pain, but it does hurt worse after working on his building projects and his horseshoe competitions. He has no history of injury to the affected limb, especially the wrist, but he is right-hand dominant. The patient has been taking ibuprofen for about 2 months to help with the pain, so this last fact here tells me that it's an ongoing problem that he's had for a while and still hasn't gotten taken care of. So the patient is tender to palpation over the extensor pollicis brevis as well as the abductor pollicis longus at the wrist, as we expected. He has a little redness, no deformity, which is good, and a little bit of swelling. With his active range of motion at the wrist, where he moves the wrist on his own, he's lacking some range of motion with pain in ulnar and radial deviation, but he's within normal limits for the other planes at the wrist. With his active thumb range of motion, he's lacking with pain in all planes. With passive range of motion at the wrist, which is where I, the clinician, am moving his wrist and asking him how it feels and measuring the range of motion, he had some pain with end range ulnar deviation, as that extensor pollicis longus, or brevis, got stretched. With passive range of motion at the thumb, he had pain with flexion and adduction. With the manual muscle testing of the wrist, he was lacking strength, left or right compared to left, and he has been painful with radial deviation, but within normal limits for all other planes. The manual muscle testing of the thumb is lacking and painful with extension and abduction of the carpo-metacarpal joint. So this carpo-metacarpal joint is where the two tendons of the two muscles I talked about go across. And extension and abduction are the functions of these two muscles, so it's expected for there be lacking strength in those two planes. Finally, I performed the Finkelstein's test, which was positive. But the Finkelstein's test usually hurts regardless of injury. The Finkelstein's test is performed by holding the hands out in a handshake position, bringing the thumb to the middle of the palm, grasping the thumb, and then pulling the wrist down to stretch. And as I'm doing this, I'm performing this, and it's hurting. So the Finkelstein's test doesn't always indicate well the actual injury. So as we expected, and as we already knew, obviously, the diagnosis is that Mr. Johnson has moderate grade DeQuervain's syndrome from repetitive hammering and horseshoe throwing. For differential diagnosis, we have scaphoid fracture and cervical radiculopathy. Our plan is to refer the patient for corticosteroid shots to reduce swelling and promote healing. I will also educate the patient on an anti-inflammatory diet and encourage the patient to RICE, that is, rest, ice, compress, and elevate. So the patient will cease all strenuous and painful activities especially, and immobilize the wrist until the pain subsides. We'll use ice to control the pain as needed, and we will compress using a immobilizing splint, which will also provide some compression. And we will elevate. When possible, keep the wrist elevated above the level of the heart. The patient will attend 3 therapy sessions per week until cleared to return to activity or until insurance money runs out. The patient will begin stretching when pain has subsided, performing twice daily, holding the stretches for 30 seconds, 3 times each. And the patient will begin strengthening when the pain has subsided, progressing into more aggressive exercises gradually. The patient will perform 2 sets of 10 repetitions at each therapy session. While the stretching and the strengthening are not going to alleviate pain, and the condition is not a condition that can be recovered by stretching and strengthening, after resting for several weeks or a month or more possibly and being immobilized, the wrist and the thumb and the fingers will have lost some mobility and will need to be strengthened back to a healthy state, especially since our patient is slightly older. At 65 years old, he needs that preventative care to maintain function as he ages. The anti-inflammatory diet will consist of eating more whole grains, more vegetables and turmeric, garlic, and beans, more fish and more nuts, which have a lot of healthy fats as well as proteins, and eating less of highly processed foods, highly processed sugars especially. And the highly processed sugar is going to be found in snack foods, candy, sugar, and coffee, and even sweetened fruit juices, as well as alcohol and salt. Doing this should lead to a condition more suitable for reducing the swelling found in the wrist. After the immobilization and the splint and the corticosteroid injection, the patient will need to perform these stretches as directed to do so in the plan. On the left here is an educational video about a number of stretches. So the first is a radial and ulnar deviation and a handshake motion to restore motion. Then there is supination form of that. Prayer pose is a very useful stretch, as well as a reverse prayer stretch. With this stretch, I would recommend balling the hands into a fist to achieve a greater stretch on the thumbs. Additionally, on the floor or on a table or mat, you can do, in this case, a pronated wrist flexion stretch, which will assist in opening up the wrist, as well as a pronated wrist extension stretch. And with that one, it would be better to ball up the thumb into a fist. On the right, we have first a passive wrist extension stretch in a supinated position. It's going to help the wrist flexors. And then we have, moving into pronation, another wrist extensor, wrist flexor stretch, stretching the wrist into a wrist extension. I would recommend grabbing the thumb for this stretch too. After these stretches, we're going to move into the wrist flexion stretch, and I would recommend grabbing the thumb underneath the fingers to achieve a greater stretch on the thumb here. Supination, you also have in pronation. After the stretches, we have strengthening. One exercise is the 5-finger death push, which is going to be showed here on the left. So with the fingers spread wide, you're going to push your hand down into the floor and then apply pressure with the top hand there. It's an excellent exercise for strengthening the hand and the wrist. On the right, we have using a dowel rod, or in this case, a curtain rod. This is wrist flexion and extension here. Radial deviation. And anything can be used for these exercises, including dumbbells, or books, or a water bottle. Just anything you could think of or want to use. More strengthening exercises for the wrist include, on the left here, a can drop or a ball drop, which is a more reactive type of strengthening exercise, which would be helpful for strengthening to acquire better function. As noted, anything can be used here. There's a weighted ball, or in this case, a can of salsa. Also beneficial is a gripper or putty to improve grip strength. In this case, I'm using a plastic salt shaker. Anything can be used. You squeeze repetitively with repetition volume as directed in the plan. Finally, we have the resources I've used for this video. I hope it's been enjoyable, informational, and I hope you've learned a lot. I think that's all I have to say about this video. Thank you for watching. Oh, and also thank you for bearing with the Chainsaw Massacre in the background.